over the Affordable Care Act has been going on for almost 5 years now. Sometimes it's hard to remember what the issues were when the law was passed. Well, one person who certainly remembers that debate is former Delaware Congressman Mike Castle. He is back as our first person this week. Congressman, glad to see you.
Thank you, Charlie. Good to be here with you.
Does it surprise you that we are still debating this 5 years later?
Well, it should surprise some, but it doesn't surprise me much. I didn't like the way that bill was put together. Essentially, it was outlined at the White House. It was put together in the House of Representatives by the majority party there, the Democratic Party. And even then, I thought there were serious issues that needed to be addressed, and they weren't. And lo and behold, now we have all this confusion and problems which exists. Hopefully it will still work for the benefit of the country, but that's now been tossed up in the air and nobody's certain. Well,
we want to show you a clip. It's from our very first episode of First from September of 2009. The topic back then, health care, and it's you and Senator Tom Carper, so let's take a look.
The kind of approach that I think makes sense is to take as a model the Federal Employee Health Benefit Plan, large purchasing pool, replicate that with a national purchasing pool called the National Exchange, and to introduce competition if it's needed in a state or a part of the country. And that could be a cooperative. It could be taking something like Mayo Clinic, Geisinger up in Hershey, Pennsylvania, the Cleveland Clinic, and sort of put those on steroids and grow them to be effective in other parts of the country.
What do you think of that idea?
Well, I love it. I think it's a sound idea, but I also think we need to go out and mine for other things that could save money. I'll give you one example, and that's medical malpractice reform or tort reform. There's a lot of cost-saving aspects of this that have not been looked at. Then, when you've done that and put it in place, take that money and start perhaps to expand Medicaid and perhaps provide vouchers or help for people who are presently uninsured. So I think there are ways of doing it more incrementally, and I think the president should back off, do a more incremental plan at this point. Hopefully we could get that done, and not one which could be disruptive to health care as we know it.
Now, my predecessor, Stephanie Aldrich, asking the questions that day, but, do you feel like Obamacare, to use your words, disrupts health care altogether? I feel like you were alluding to that before we showed the clip.
Well, it clearly has. I mean, you look at the number of people who are having the plans that they had before rejected because they don't meet the qualifications of the plans in accordance with the Affordable Care Act. That's disruptive. Obviously, people having to spend hours on computers and on telephones trying to get into the program is disruptive. The fact that we're not completely certain that we have the medical personnel to undertake all the extra people who are going to be able to receive health care is an issue. We want to make sure that people do receive health care, but we've got to make sure that they're doing it at a doctor's office or a community health center or something less expensive than an emergency room. So there's a lot of disruptive aspects to this that have not been answered yet.
I mean, those problems notwithstanding, though, have we, in all fairness, given Obamacare a fair shot? We haven't even really experienced or understand, because of these problems, we haven't been able to experience what it is. Is it fair to say right off the bat it's no good and we need to?
Well, I'm not saying it's necessarily no good. It's got problems for sure, and I think it's going to be 2 or 3 years before you can really truly make a judgment that this is working and it's helped with health care throughout the country. The theory is that you have all these uninsured people in the United States today. If indeed they can receive coverage, we can have prevention instead of treatment. We can avoid having people go to hospitals, to the emergency rooms, which are very, very expensive, and receive their treatment otherwise, and hopefully that would work. But so far, each step that has been taken has been wrong and has been a problem. And so calling it a total failure would be a mistake, but to suggest it's working well would also be a mistake.
Now, in that clip, Senator Tom Carper, the insurance that he's describing is essentially what we have, and your response was you loved it. You liked the idea, you thought it was a sound idea, and then yet when time came for a vote, you voted against it. So what happened there?
Well, what Tom and I talked about, which I actually think was a pretty good plan, maybe we should have been putting it together, but what we talked about that day is fairly simplistic. It is basically taking the federal health insurance plan, which is a series of choices of people, including members of Congress and every other federal employee chooses as to what kind of plan they want. You can go from less expensive to more expensive in your coverage and that kind of thing. To be able to offer that to people or something like it to people in the United States of America. And instead, they went with the plan which they have, which is much more extensive. It's an absolute mandate on individuals. It'll eventually be a mandate on businesses instead, and it's just simply not worked particularly well. That's what I did not vote for and do not support today. But the concept of what Tom was talking about and my additions to it in terms of dealing with cost issues, medical malpractice and other issues that could streamline what we're doing in medical care, I think could have worked. I wish somebody had listened to us.
Can you talk about some of the closed door discussions that were happening leading up to that vote? I mean, I know it was a while ago, but.
Yeah, well, I mean, I can tell you that unfortunately the Republicans took a very negative approach to it. They were probably never going to support what was termed as Obamacare, which is the Affordable Care Act. That was a problem because there wasn't input on it. The Democrats in the House of Representatives who put this together essentially did not consult with Republicans or listen to those various ideas, so that was a bit of a problem. And immediately you had a political war on your hands, and then once Republicans voted against it, they're just looking for problems, and then all of a sudden you have this whole business with the sign-ups going afoul and various other issues which exist out there, and Republicans are all over that. And I truly believe they did overlook trying to discern how we could save money with respect to health care as well. It's very expensive. Medicare and Medicaid are really driving the cost increases in the United States budget right now. And unfortunately, I didn't think that was addressed in this Obamacare, and I think it could have been. I think with time, some solutions could have been worked out that could be helpful.
So in an effort to change health care, do you think that President Obama kind of threw the baby out with the bathwater, like he just wants to get it done, so they maybe rushed
Yeah, I think so. I think it was, they treated it a little bit too simplistically. It's a very complicated subject, and you know the statements that he made, such as whatever plan you have now, you'll be able to keep, which turned out to be inaccurate, were a mistake. The fact that it may eventually address some of the cost issues in the country, but maybe not. I mean, that's uncertain at this point. That could have been, I think, dealt with face on better than it was. I think an understanding to people as to what they were going to be dealing with, because a lot of people don't understand it now, could have been done. And clearly, they should have brought in the kinds of mechanics who could have put together a program that would work as far as the sign-up is concerned with the computers, et cetera. So there's been a lot of baggage here, and unfortunately, I think in his zeal to get this done, there may have been a little bit of overreach, not enough time and thought given to the actual execution of the plan.
The partisan politics you described when you were in Washington, it sounds like you could be talking about Washington today.
Oh, no, it's worse today.
It's worse today.
If anything. Yeah, that's true. I mean, partisan politics, that's a whole different subject, but partisan politics has become a huge problem in America with the use of computers, particularly in the House of Representatives, for the reapportionment process. You have districts that are very Democratic, very Republican, so you have a lot of natural fighting going on there with all the ability to analyze immediately what's in a piece of legislation, whatever. You can attack your opponents.
Well, do you blame
once,
members of
it's
your party for the government shutdown we had?
In part. I blame everybody. I mean, I start with the president, who I think has had a terrible run with congressional relations from the very inception of the time he became president of the United States, and that culminated in his inability to pull people together with respect to that. But clearly, the Republican Party had some significant problems. I think that Senator Cruz was wrong in terms of what he did, and I think some of those who followed him were wrong in terms of that. I don't think there should have been a threat of a shutdown. Hopefully it will not happen again. So I clearly blame Republicans as well. But on the other hand, Democrats have shown very little flexibility in terms of dealing with some of the major issues of concern to Republicans, such as the cost of entitlements and what can we do about it. We need to have a debate in this country in which people are really talking to each other, listening to each other, and conceding to each other on positive points that benefit the public and not the Republican Party or the Democratic Party.
Well, you know what they say, compromise, true compromise, no one's happy, right?
I know compromise is now a dirty word in
Right.
Washington, D.C., which is amazing.
Well, what would it take for you to get back into politics?
Oh, about 20 years off my life, and Jane, my wife, being a lot happier with the fact I'd be in politics. So I'm probably through as far as that's concerned. I'm just looking at it from the outside. I feel comfortable with our representation in Washington from Delaware. And I think there's some very good people in Washington in general. But I think some of the leadership, some of the party strategies lead to these situations where you just don't move forward. And that, to me, is a tremendous, tremendous issue facing the country. And it's going to take, I think, somebody running for president or perhaps a few people losing elections who are too strident and too inflexible in their viewpoints for the voting populace to start thinking a little bit differently about where we're going.
Kind of want to end on a lighter note, but there's a trail named after you now. It's not a bad legacy. Have you been out there? I know you have to have knee replacement surgery soon, so I don't know. Have you been out there yet, or had a chance to get out there?
Well, I've been there at the openings of this. It was actually an interesting proposal. It came to us through a bike group and a state legislator. Jeff Dayton and my staff worked on it, and we had tremendous help from the other elected officials, both political parties. Everybody was for this because essentially we own the land. So the cost of it, although it's relatively high, I suppose, but the cost of it compared to the cost of usually doing a trail where you have to acquire land or the right-of-way or whatever was de minimis. And we're able to do a trail that's going to extend for 13 miles. I have not done the entire trail. My wife did a good part of it the day we had the opening, and I walked for a couple hundred yards. But my knee, it does sort of prevent too much biking at this point, but I'll get back to it when the knee is replaced. But I've talked to people who've been used that trail 4 and 5 times already, who have great things to say about it. It's flat. It's right along the water. There's a restaurant along the way. You can park nearby, and people really enjoy it.
Do you feel like you've made it? There's this trail is named after you.
No, I have a different feeling, Shirley, and that is that I'm sort of over the hill. They start naming things for you. It's a problem. I never wanted the trail named for me. It was not my idea, and I'd prefer not to have anything named for me.
Okay. Well, Mike Castle, former Congressman and Governor, thank you so much for talking with us on First.